I just read the summary, of course, but it's data. So you're talking about facts and you're
Yeah.
talking about information and you're not talking about individual people, but you
No.
are talking about protecting people, including people who identify as transgender. Like there's nothing, it's pro everybody in
Yeah.
as far as we want everybody to be safe, have the right health care, be in the right place they need to be for whatever services they are going to get. It's so yeah, it's quite neat and tidy, really, when you think about it. But it's beneficial to everyone, and they don't want to know that because you're using the wrong words. You're using sex and gender. Oh dear. Well, did you had to get escorted safely home, or were you?
Yeah,
Yeah.
yeah. I mean, I grew up in Bristol, so it's my home city,
Oh,
and yeah, the security guy was very nice and whisked me past the I mean we
wow.
actually had to we had to move because they had scaled the walls to bang on the windows. We had to move upstairs to a higher up lecture theatre that they couldn't get to, and then I had to
Right.
be kind of whisked out of there at the end. So it was, yeah, it was absolutely surreal.
Right. Were you speaking to a general audience or a specific department or group of people?
It was the Department of Social Policy.
Oh, okay. So seems
Yeah.
about right. Yeah. Oh dear. Well, I'm gonna see if Chris has opened the other Chris has opened the Q&A here and see if I'm going to be able to have a look at it because I can't as of yet, but I'm going to have a look to see if there's some questions. There we are. Okay, so we have a Q&A open now for anybody that might have some questions for Alice, and there's none in there right now, but as soon as they start coming in, I'll read them out for you. So um, the second, while we're waiting, the second part of the research, was that already completed and released or is that yet to
Yeah,
come?
yeah.
Okay.
That's so I can send you the link for that if that would be
Okay.
useful for the audience.
Okay.
Um, Not sure how to do that, but
Oh, okay. Well, no,
um,
we can share it on our website when we share this
right, great,
recording.
yeah,
And
great.
that's is that the implementation part or?
So no, so the first part is on data collection, and the second part is on barriers to research
Various
specifically.
research. Okay.
So um, there's all sorts of barriers that people have faced in this area, not just the lack of data, but also, no platforming, not being able to organize events, um, not being able to get funding, not being able to get past ethics committees, and so on and so forth.
Right.
And just the kind of chilling effect that when you witness so much aggression, the whole purpose of all that aggression is to make people look at it and think, oh my God, I don't want to experience that. So
Hmm.
you only have to burn a small number of witches in
Yes.
order to encourage everybody else to shut up.
Yes. Yeah, for sure. For sure. We've got a couple questions coming in now, and the first one is, how would you recommend speaking to government and organizations about the importance of sex versus data? And I mean, I feel like we'd send your report to a Canadian government here, but um, they're looking for any um, suggestions about how to talk to government about this type of thing.
Yeah, I mean, I hope my report's really useful that people can send that to, and I know a lot of people have been using it in that way,
Hmm.
sending it to organizations and saying, look, this is this is an official report, this is how it's done. Um, and the only other thing I can say is just it is frustrating, and keep plugging away and keep asking people for conversations and take up any opportunity that you get of a conversation. I know how frustrating it is because I've been working
Hmm.
on this for years.
Hmm.
And at first it felt like, well, no one is even willing to have this conversation.
Hmm.
So yeah, and I'm sure it's even more of a struggle in Canada.
Yes.
So you have my sympathies.
Yes. Yeah, and yeah, I would say to the woman asking that we'll put the links to these, or maybe you've already seen them. It's easy to find these reports that Alice has done, it is very useful and it is very neutral and it is very common sense. And so there's nothing scary about it. I think, like you say, people's brains go out the window sometimes when they're talking about this because their
Mm,
fear of being of offending.
mm-hmm.
It's not in any way offensive to anyone, but these will come in handy. And so I appreciate, not only appreciate that you're doing it in your own country, but I think we will around in other countries find it really useful to refer to for sure. Another question here is someone has is what are some examples of data collection um, protecting a person that identifies as the opposite sex other than healthcare? Are there other things that you've come up with against?
So, um, I think healthcare is the key, is the one where the risks to a practitioner not knowing your actual sex are potentially fatal. So it's the most obvious example. Um, but I think that there are other cases where, from a safeguarding point of view, for example, if if social services or volunteer groups like the guides or the Boy Scouts or whatever, if they don't know an individual's sex, whether that individual is a child or a volunteer or a staff member, there are obviously situations that can arise that may be dangerous for anybody, regardless of whether they are trans or not.
Right, right. Okay, all right. Um, this is a broad question about the big picture. Um, to shorten the marathon, what do you have any suggestions about um, activists who are supporting sex-based rights? Any advice?
Yeah, I mean, I guess in the UK, we have come further on this than probably any other country. And I think part of that has been about working in a really cooperative and non-tribal way. So women working on these issues have worked across all of the political parties. Um, so that whereas I know in the US this the idea that sex is real and important, and that you might want to collect data on it, or that you might want to use sex as a category in other contexts like sports and so on, has been portrayed as a right wing idea, and that there's been an attempt to portray it as right wing in the UK, but it's so obviously false because so many of the women working on these issues are, lifelong lefties and
Mm-hmm.
trade union activists and so on, and then you also have people who are conservatives, but we're all working together.
Mm-hmm.
um so I think that's really, really important. You have to set every other difference that you might have with anybody aside and
Mm-hmm.
just focus on this. um don't try to do it on your own. Make sure that you have a group, and I think whatever profession you work in, that's really, really important to protect yourself. um at UCL, there's been a few of us putting our heads above the parapet from the beginning. And I think without that, it would have been really, really hard for me to do it on my own.
Right.
Um, but I think I've also been personally fortunate because as soon as I started asking, my peers in quantitative social science and social statistics to stand up and be counted on the fact that data collection on sex was important, many, many of them did. And so I never was alone.
Mm-hmm.
And so I think maybe that would be harder in Canada, but I think it's
Mm-hmm.
worth a try. You've got to try to bring people with you as much as possible rather than trying to be a sort of solitary hero or heroine.
Right, right. Yeah, no, good advice for sure. Um, Someone was asking about the sharing of information. Do do you know if governments share and learn from each other's mistakes or successes or research? That's
Uh, it's a very good question. I know that a lot of organizations in the English-speaking world look to the Office for National Statistics, and I'm sure they're not the only. So yeah, I'm sure there is, maybe not so much across government, but across statistics bodies, I think
Hmm.
there is some sharing and learning.
Okay.
Um, so and I think in the past, people have for example, the Australian Statistics Body, I think, would tend to look to what the Office for National Statistics was doing and just kind of copy it on the assumption
Right.
that it was well done.
Right.
Um, and obviously, not just in this area of sex and gender. Well, not obvious, probably for this audience, it may not be obvious, but there have been a few question marks raised about ONS data, not just in this area, but in the area of economic statistics as well. And
Right.
so I think hopefully there will be, learning from those mistakes that is international.
Hmm.
And yeah, I certainly hope that those bodies talk to each other.
Yes. Well, and I think this woman who asked this question was thinking particularly about so the ONS is the UK Statistics
Yeah.
Department, and here it's called Statistics Canada. And I think her hope in her question is that we would, our country would look to the UK Statistics Department to learn from that. I mean, you don't work in government, you don't work in this
No,
department, so you
no.
wouldn't know what their collegial relationships
I
were.
mean, one thing I would say is that I'm very, very happy to talk to anyone in Statistics Canada or any of
Right.
the other
Uh-huh.
national stats bodies so that they can learn from some of the mistakes that we've made in the UK
Right.
and from hopefully moving forward as well.
Right. Right. Yeah, and I think we can share your information or this video or anything that we have here now that we can share that with other people who might want to watch it in private or read it in private and then, start getting into the places where maybe they're a little bit uneasy or uncomfortable and they can find out that it's really not scary.
Hmm.
Um,
Yeah.
and that it's really important as well. Um, Now, the next question, let me see if I can, it's a longer one. Hmm. I'll read it out and see if you understand it. I don't completely understand it at the moment. If sex data needs to be collected on the basis of sex on a person's birth certificate, how do you suggest addressing data collection where sex was assigned incorrectly and where actual biological sex matters? Do these cases affect data quality? I'm not sure if they're talking about
Right, right. So I think they're talking about
DSD.
DSD and the fact that in a very, very tiny number of cases,
Right.
um, it can be difficult to determine sex at birth. Now, in the UK, and I think in any country with an advanced medical system, um, a baby is not going to leave the hospital without a clear determination of sex. But of course, if you're born somewhere where, maybe you weren't born in a hospital, and that there will be some people for whom that initial determination could have been wrong. And I think this is again one reason why I don't think people should ask this question, which we sometimes see, what was your sex assigned at birth?
Mm-hmm.
Because in those very rare cases where it was assigned wrongly, that's not what we want to know. We want to know what your sex is. So we should just simply be asking people, what is your sex?
Right.
And it's your sex at birth, but it's not your sex assigned at birth. So sex is determined at conception. Um, and for the vast majority of people, it will be correctly observed at birth, if not before, in utero. In a tiny, tiny number of cases, that won't be right, um, and those people can simply just say what their sex is. To ask them what they were assigned at birth is actually incredibly intrusive for that
Mm-hmm.
tiny number of people where it might be different from their
Right.
actual sex.
I think in your writing you suggested it was one person or two people every 10,000 people, or was it
It's
even less than that?
0.017% of people, so
Right, right,
very, very, very
right,
small
right.
group of people who have DSDs. And even within that group, um,
A lot of variation.
it's not so the proportion for whom you would actually have an incorrect sex assignment at birth would be even smaller than that. And I don't think we can even quantify that. It's a really, really tiny group.
Right. Yeah. Yeah. Um, okay. Here's another question. Is there a discussion amongst your colleagues about the issues of valid data and science within this context? Aside from the politics, is there concern about the statistical data that's being compromised and the ripple effects within the field?
Yeah, I mean, certainly the scientific issue is really important. And so, I mean, for example, um, I've done a lot of research in the field of education. We have our university admissions body, it's called UCAS, and they collect data on the characteristics of applicants for degree courses, and that's obviously really important if you're interested in um, equalities in terms of admissions to university as a whole, or to particular, high status universities, or to particular subject areas. And obviously, one of the things you might be interested in is whether girls are doing STEM subjects, whether boys are doing arts and humanities, and so on. Um, so, but this organization that collects this data stopped collecting sex and started calling it gender in around 2015, which is absolutely classic in terms of what
Mm-hmm.
I showed in that graph.
Mm-hmm.
And then in the last couple of years, they've even made it so that it's no longer a binary variable. They've got non-binary as a separate category, and also prefer not to say. And so you're losing data on quite significant numbers of applicants. And once you've lost that, there is nowhere else you can get that data from. So absolutely, it's a real problem, and that's just one example, but this is happening across the board. So it's really, really problematic for research, and it means
Mm-hmm.
that any research that features sex is affected.
Right. So do you think this is like they'll just be the sort of the lost years? There's no way of going back and correcting data that was, you know, acquired before. So there's just going to be a gap there for 10 years or however many years where there's a lot. I know it was a slide, so it's
Yeah,
probably more than
yeah.
that, but the lost years of correct sexed data.
Yeah, there will be lost years, and that's why I feel quite impatient that we really need to fix this now.
Mm-hmm.
Because the sooner we fix it, the less lost years that we have.
Mm-hmm. Yeah, for sure. Someone on here who's keen to get the Canadian government to review your report and possibly invite you back to speak. Um, do you have suggestions about an approach for that? Do you think um, there's a good route to share that information?
Yeah, I mean, I'm absolutely open to coming and talking to the Canadian government, and I think they should invite me back.
Yes.
Um, they can read my report and see, that there is nothing, absolutely nothing remotely hateful in there, and, you know, invite the critics to come and
Mm-hmm.
talk to me and ask tough questions that they want to ask. I'm very, very open to that. Let's just have the conversation.
Mm-hmm. Right. Yeah, for sure. And I guess it's maybe finding the right, well, maybe Statistics Canada, because you were going to talk to a particular department, right? The Department of
It was
Justice.
the Justice Department. Yeah, yeah.
But Statistics Canada is the broader, more generic,
Hmm.
wider collection of, of the population. Um, they do they check with the whole population on every couple of years, and we fill out our forms. And maybe if somebody knows somebody in there, we can find a way to get that
Oh,
in there. But I
well,
think now that you have this, as opposed to last year when you didn't have it yet, people can read it and find the places where they thought they'd be scared or offended and realize that they're not going to be. But even if people were offended by something, it's data and statistics. It's not political opinion or viewpoint or commentary, and that's the part that's so frustrating, isn't it? That you're trying to collect facts about your population that would be useful
right,
to everyone.
right.
Yeah,
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 and I think there's a broader point that, when organizations aren't willing to kind of engage in discussion and when certain thoughts are just shut down, you don't make good decisions
mm,
because you're then just engaging in groupthink and
right,
nobody is challenging. And that's where we've ended up with real problems, not just in data collection, but in social policy on sex and gender in general. So yeah, I am absolutely happy and would be delighted to talk to anybody in Stats Canada or broader Canadian government who would be willing to have that conversation. Let's talk.
right, right. Yeah. Um, there's one more question here at the moment, and it's about the people that deny that sex is a biological,
Mm.
um, rather a construct rather than a biology, and they think they don't believe that it's immutable. Has that come up in any of the comments or any feedback or anything in your work?
I mean, it's so interesting, isn't it? Because this is an idea that comes out of postmodernist queer theory, and how on earth did such a kind of esoteric and anti-scientific idea end up having any influence on data collection? And I think very often the people who are making decisions about data collection don't realize where these ideas come from, and what it is exactly that they're kind of being influenced by and signing up to. Um, it's obviously nonsensical. Human beings are mammals. We reproduce sexually. There are two sexes. Um, and that's all there is to that. Um,
Right,
so but it's and you get this odd kind of pincer movement of people both denying that sex exists, and then you get people saying no one has ever denied that sex exists.
right.
So it's a strange little dance that people do. But I don't think anybody serious actually believes that sex isn't real and that it isn't binary.
No, I think you're right. Unless they're a very disturbed and troubled person who's having other cognitive or mental health issues that
Hmm.
they've shut certain things down or yeah. So I think you're right. If they're adults and they're yeah. We've got a few more questions have come up in the last few minutes. Do you have any comments or suggestions about reasons that sex data is important to in grade school education? There's been a trend in not sharing this information with staff working in schools. Um,
Right. I mean, well, that sounds like a safeguarding issue if it's that staff aren't being told about the sex of children who are potentially going through some kind of transition.
right,
The other reason it matters is obviously because people do research on outcomes for children, and sex is one of those characteristics, and the intersection between sex and other important characteristics like social class and ethnic group, and we can't look at that if we don't have sex.
right, right. Um, here's a new one. Do you think data collection might not be accurate anyway, as people who believe they're the opposite sex won't list their sex properly? I mean,
Yeah, there's always potential for inaccuracy to some degree, but when we design a question, we're always trying to maximize the accuracy and the clarity of the question. So it should be clear to people what the target of the question is, and what response is wanted. Um, so again, we need to go back to when we're asking a question, what is it that we're trying to find out? And if we're trying to find out what the sex of a person is, then that needs to be clear in the question. So yes, you might get a few people who give the wrong answer, but you'll certainly get more people giving the wrong answer if you tell them to give the wrong answer.
That's right. Yeah.
So yeah,
Do the best, have the best clarity, and do the best that you
yeah,
can, and eliminate the problem answers as best you can. Because,
mm,
yeah, there probably always has been some people making stuff up over the years, but there's been more lately that because of the lack of clarity and the lack of separation of the categories,
mm,
right? That's really important and beneficial to everybody. So, yeah,
yeah.
sure. So, what is the best way to? Now, I found your reports because I was doing research about this conversation before we met. I know you have your own website. What is the best way for people to get more information about you, your work, copies of these reports in full and in summary? There might be some people who want to read 250 pages, and I'd like to read it all at some point. I didn't yet. So, what's the best place that people can go, Alice, to
Yeah.
find out
Let
more?
me just find the the website that I have with all of the documents in one place is sullivanreview.uk. So you can go there and find all of it.
Okay. Wonderful. And it's what's next for you in this area? Are you done with this and you're on to something different?
No, I think I'll be working on trying to get these recommendations implemented
Right.
for some time. And I'm also just finishing off a book that I've been writing called Sex, Lies, and Statistics. So I'm
Oh,
just trying to get that done, try to
oh,
get it
that's
delivered. I'm
wonderful.
behind schedule.
Are you getting a lot of invitations to speak about this to
Yeah,
community groups, to government? Yeah.
yeah. I
Okay.
have been very busy with talks this term, so I hope not too many of them are as dramatic as the one in Bristol on
That's
Wednesday.
right. That's
That
right.
was a bit much.
Right.
But I don't think they will be. Yeah.
Well, hopefully some of us here in Canada who are interested in this and concerned about the lack of clear data will make some moves to try and encourage Canadian government or departments within if, to have a conversation with you, and we'll certainly share this information with people who want to care, who care enough to read it. I think it's safe to send a document to people, and they can read it in their own time and see what happens with that. But it's so important. It's something that people don't think about. I think a lot of the time they're not aware. You know, we are used to having the government do the things they do, and hopefully we get
Mm,
the right kind of services. But it's always been based on research and statistics. So thank you for doing what you're doing, and thank you to everybody who came and attended this. It is being recorded. It will be on our website. We can, as a link from our website, it'll be shared down the road not too long from now. And if you want more information, people, about Women's Space Vancouver, you want to get on the mailing list or make a donation to cover some of our costs that we have, or just read more about it, go to our website, just put Women's Space Vancouver in your search engine, and you can go there and find out more about this. And that's where you'll find this information about Alice when we get it up there as well. So thanks, Alice, for taking some of your Sunday evening with us. I'm glad it was 6 o'clock, not 7, because your time changed, but really appreciate it. Yeah.
thanks
Thanks
for having
again
me.
for
It's good
coming.
to talk.
Yeah. Thank you. Bye, everybody.
Bye.